Hi, do you have pelvic pain, maybe pain with intercourse, and you've also had a C-section birth? I want to talk to you today about a couple ways that you can help yourself at home. Believe it or not, your C-section scar can be causing some of that pelvic pain that you're experiencing. Hi, I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. I want to share this tip with you. We're going to actually just use your hands. So keep in mind, even if you had a C-section a long time ago, this can still help you, okay? If you've had a baby recently and your C-section has been a little bit more recent, you want to wait at least 8 to 12 weeks in order to do this technique that I'm going to show you. Okay, let's get started. Okay, for this technique, you're going to lie down on your back and you can keep your knees bent. That way you don't have as much stretching through that C-section scar. So what you're going to do is you're going to use your own hands and you want to be on the surface of your skin for this. Now, I don't have a C-section scar, but I just kind of made one with a marker so you can have an idea of what I'm talking about. So you're just going to want to pull pants down a little bit so that you can see that C-section scar. And you're just going to take your fingertips, almost like you're playing a piano, and you're just going to place it right over the scar. Okay, and then what you can do is almost just kind of press down like you're pushing on a trampoline and just check in first to see mobility. And you want to just feel for any raised edges. Is there any discomfort or pain with anything that you're feeling? And how well do the tissues feel? And even check, say, right side versus left side. Now, I want to take just a moment to say, for some women, even looking at the C-section scar or touching it can bring up some emotion. So if that's you, I'm going to give you just a variation of this. So keep in mind, if this already gives you a little anxiety to think about, you might want to do the modification. So what you can do from here is you're going to sink down just enough where your body is kind of pressing back against you. You don't want to force your way in and really press hard, almost like you're just leaving fingerprints in soft sand or clay. Now, once you get down there, you're going to very gently pull up towards your head. So you can see, I'm just kind of, hopefully you can see this, I'm just very gently just taking up the slack of my connective tissue and my skin. So I'm not sliding on the surface of my skin. Okay, I'm sunk down a little bit more than that. And then from there, you just wait. Again, you kind of come to a barrier where it feels like, oh, that's as far as I can go without forcing things. Okay, wait there for, if you can, a minimum of 3 minutes, but ideally 5 minutes or even longer, paying attention to what your body wants to do and following it where it wants to go. So you might notice that one side starts to release more than the other, or that your hands go at different speeds or at different depths. Now, I'm going to show you a variation of this. You can actually work a little bit above the C-section scar. It might be a little easier for you to not be directly on that scar. So you can even do something like your whole hand, like right around the belly button. You can do the same thing. Sink those hands down, wait till you get to that barrier, and then very gently pull up. You're going to start to feel that very gentle stretch down into that C-section scar, and you might feel it even lower down into the pubic area, getting some release of that fascial tissue or the connective tissue in through the bladder and your organs, and that's all good. We think about why the C-section scar may have an impact on the pelvic floor is because those muscles are down a little lower, but the scar could be really tightened down and not allowing the mobility that you need in any surrounding tissues. Okay? So give that a try. I'm going to give you one more last tip for this. Okay? So another variation of this is taking just a little inflatable ball. This one's about 4 inches. And what you can do, again, knees can be bent, or if it feels okay, you can go out straight with your legs, so you have a little bit more room here. You can take this ball either just below the C-section scar itself, and you can press down and just kind of use the ball as a little bit of a massage tool, okay? Or you can even go above that C-section scar, and you can do kind of into your abdomen. But that's going to help. Remember, everything is connected. So even if it's that we're trying to relieve pain into the pelvic floor area or the scar itself, we don't have to go directly over those tissues, okay? All right, thanks for watching. Let me know. Give this a try and let me know how it goes for you.